Labiaplasty overview, take one.
Labiaplasty is a procedure that is done to address hypertrophic tissue of the labia minora. And all that is a medical term for excess tissue or elongated or puffier tissue within the inner labia or inner lips of the vagina. You can also have what's called a labia majora reduction, which addresses the outer labia. And that also is kind of done through an incision where we just reduce any of the excess tissue that's present.
I mean, I would say the procedure for labiaplasty, when we're talking about labia minora, is a definitive repair. So once we remove the tissue, the likelihood of it growing back would be extremely rare. Now, there are certain things that can change the way the labial tissue sits, I guess, if you want to say that way, like vaginal deliveries can change the appearance of part of the labial tissue. And then changes in hormones too can also, change. Aging, as we lose collagen and elastin naturally, that can make the tissue appear a little differently. And then if you're on any hormone therapy, specifically testosterone, can also create changes in labial tissue after a labiaplasty.
Yeah. So labiaplasty procedures, the way we perform them here in our office, we actually do them just in our clinic under a local and oral anesthetic. And that's part of what sets us apart, I think, from a lot of other clinics. Most other clinics are going to do them either in an operating room or in a surgical suite, whether that's in their clinic or also in a hospital or surgical center. And a lot of times that's under anesthesia. So typically you're paying facility fees, anesthesia fees on top of the actual procedure fee itself. So again, what sets us apart is we do those here in the office. And they take about 3 hours on average. Dr. Shashoua does a majority of the procedure itself, and then Julianna and I, we do a lot of the suturing or closure of the tissue post-procedure. And then we'll also do some minor trimming if we need to as we're closing, if we feel like there's any asymmetry or anything like that. But on average, I'd say for the most part, they're about 3 hours.
Labiaplasty addresses excess tissue of the labia minora, the labia majora, and also the mons pubis, which is the tissue right over kind of the suprapubic area. And oftentimes this is just genetic, right? The way you're born. Some women have innies and some women have outies. So the reason why women get labiaplasty or reduction of this tissue is a lot of times just physical comfort. So, some women who are very active and they, find that their tissue gets kind of caught in tight clothing. Sometimes it's uncomfortable during sex and tugs. And then obviously there's the aesthetic reasons as well, like camel toe, right? Women who, again, like to wear tight clothing, they like to work out a lot and they want to get rid of those, folds. From an aesthetic standpoint, obviously that's a concern as well, and women just want to feel more confident in the way they look, both in clothing and without clothing.
Everybody wants to look good naked.
Yes, exactly. So, I think women do this mostly for themselves and not necessarily just to,
impress someone else or specifically for
so
someone
it's definitely
else.
Multifactorial, yeah.
I think probably the biggest misconception that I hear from labiaplasty procedures is that there's going to be a loss in function after the procedure.
Yeah.
So if you're seeing an experienced surgeon and someone who knows what they're doing anatomically in the labial clitoral area, your risk for decreased function sensation should be almost zero. If you are having this procedure done, again, by an experienced surgeon, they know where the nerves are, they know what to stay away from, what exactly to operate on. So they're going to be doing their due diligence. to minimize any risk associated with these procedures. Now, I will say, post-procedure, it is not uncommon to either have reduced sensation temporarily, or on the flip side of that, you can have hypersensitivity. And that's just as the tissue is healing, regenerating, and then typically, I would say for the most part, that resolves by about 6 weeks post-op.
Yeah. I would say that labiaplasty typically improves sexual function.
Especially in relation to clitoral hood reduction.
Yeah, exactly. So if you remove excess tissue that overlies the clitoris, there's just better exposure. And then also, I think from like a psychological standpoint, if you feel really good about the way you look and you're, you know, if aesthetics was a concern of yours and that's no longer a concern, that kind of gives, you know, takes away that mental roadblock that, you know, can sometimes be there, and that can prevent, you know, climax and experiencing full sexual.
Yeah, there's such an emotional and mental aspect to like women's sexual health.
Like, I don't care what I look like.
I'm like, I need a candle, a back massage, a glass of wine, a bathtub.
Yeah.
Labiaplasty, I would say, is considered both plastic and cosmetic. And you'll see, like when you go research, if you're looking for a surgeon to actually do the procedure itself, you'll find lots of specialties that do it. So plastics will do it, gynecologists will do it, urogynecologists like ourselves. But I would say ultimately, you know, in deciding who you decide to do the procedure with, whether it is plastics or gynecology or urogynecologist, what I would say, one, is when you talk to your surgeon, make sure you're on the same page. Because I have found, and we've had a lot of patients come to us who have had prior labiaplasties, and, you know, they weren't happy with the result, either because not enough labia was removed, or maybe they only addressed the labia minora but not the clitoral hood. And there are some providers who aren't comfortable touching anywhere near the clitoris or the clitoral hood, so you end up with this very top-heavy appearance to the labia minora. So go to a surgeon, one, have a good discussion about what outcomes you're looking for, and then two, make sure your surgeon is doing these regularly. I would say that would be probably even the most important thing. You want a surgeon who has tons of these under their belts and can also show you tons of before and after pictures. So that way you can get a good idea of what their outcomes look like. If you go to a surgeon and they're like, oh, I do these all the time, and they only have one before and after photo, that's suspect. You really want to have somebody who can kind of show you proof of their work.
Yeah, I'd say the recovery for labiaplasty, whether or not you're getting the minora and or the majora, is going to be a little easier than vaginal rejuvenation surgery. Typically, we recommend about 7 days off of work or whatever your day-to-day looks like. Most women are going to need some sort of prescription pain medication for at least the first, 3 days, maybe up to a week. It just depends. We'll want you on vaginal rest, and that includes no clitoral stimulation for about 6 weeks. The clitoral stimulation component, I think, would be really important if we're doing a clitoral hood reduction with a lifting of the clitoris. We don't want to kind of manipulate that area too much. And then for the first couple of weeks, we have you avoid dirty water like lakes, rivers, shared hot tubs, pools, just to allow the incisions to close. And then otherwise, it's activity is tolerated. So
I will say, I think a lot of patients, and you can kind of weigh in on this, I think a lot of patients, when they come in for labiaplasty procedures, they think they are like a very simple, oh, I'm going to come in, I can go back to work the next day. And it is not that simple. So, we try to give patients proper expectations post-operatively. Like, you're going to have pain, and we do recommend a week off, and we recommend a week off for a reason. So just keeping all of that in mind when you're considering the post-op process and the healing process.
And I think, like, from an activity standpoint, most women are back to their, like, workout routines, probably by weeks 3 to 4. And the one thing that we always counsel heavily on is to expect swelling post-operatively. The swelling seems to throw people for the biggest loop, and it can take a full 12 weeks to resolve after surgery. But just because there's swelling doesn't mean that there's necessarily need to be activity restrictions and whatnot because of it. So.
For a labiaplasty procedure, it is considered a cosmetic procedure, and therefore it is not covered by insurance.
Yeah.
So after a labiaplasty procedure, in terms of menstruation and things like that, if you have an IUD, you can always leave that in place. There's no need to do anything there. If you're having menses, we actually do recommend tampons. It just keeps the area cleaner. But if you're somebody who doesn't wear tampons, pads are fine, menstrual cup is fine. We're not doing anything operationally inside the vaginal canal, so there'd be no disruption to the incisions or anything like that by using a tampon or a menstrual cup.
As we've seen lots of patients that are coming in for labiaplasty consults, one common term we hear is innie and outie. And innie, labia minora, is where the inner lips are tucked in between the outer lips. And then the outie labia minora would be if you have labia minora that are a little bit longer, they protrude past the majora lips. So, and that's typically the patients that we're seeing for minora reductions are the outie.
Yeah.
You know.
And most people are wanting the innies post.
Yeah, exactly. The goal is for the innie for them.
So belly buttons.
Yeah, exactly.
The term